Dr. John Bergman for another Health Minute. Right now we're going to talk about arthritis, which is also called degenerative joint disease, degenerative disc disease, or osteoarthritis. We're going to talk specifically about the neck because that's where the most common area is. Now, let's look at anatomy again. Okay, from the side, normally, a neck should have a beautiful curve. Now, do me a favor. Hold your hand just like this. Okay, that's a horrible curve in the neck. Now, make it into a C shape. That's a beautiful curve in the neck. In fact, that C shape is exactly what the neck should be. Now, look at this one here. This is a beautiful curve in the neck. That normal C-shaped curve that should be 45 degrees. Each bone is separate, distinct. That neck will last a lifetime. Now, look at this one. Horrific amount of nerve pressure there. Now, this is phase 1 degeneration, which means they've lost the normal position and motion of the vertebrae. 80% of the people in phase 1 have no symptoms. Now, if this is left undetected, the bones begin to deteriorate after just about 3 years in a phase 2. Phase 2, 50% of the people in phase 2 have no symptoms. If this is still left uncorrected, more bony destruction or advancement of that arthritis to where correction is impossible. And that's ridiculous. That's a crime. Now, what do they say? Arthritis comes on when you're older? That's not true. Look at this picture here. Beautiful curve in the neck. Fantastic. Each bone separate, distinct. Each disc space separate and distinct. He's 75 years old. Absolutely perfect. Now look at this one. Horrific amount of degeneration and damage and destruction. Now, what do they say? It comes on when you're older? That's absolutely not true. Look at this. 2 perfect joints. They're obviously the same age. Arthritis and degeneration only progresses because that bone is rotting away because it's not getting the nutrition or it's in an abnormal position. Absolutely criminal. This patient here is only 54 years old. Now, let's look at a patient. Obviously, that's a horrible curve in the neck. And it's been there for a while because the bones are starting to decay. But look at this patient. 90 days later, the curve's restored. 90 days, we're starting to reverse the mechanics that would destroy those joints. Let's look at another patient. Look at this. Curving the opposite direction. The bones are literally nearly fusing together. This is advancing degeneration. This is choking that life force off. That brain cannot communicate beyond that position there. And look at the same patient 90 days later. By gosh, that joint is starting to open up. That is a reversal of degeneration. Now, let's look at another patient. You've heard of osteophytes, bone spurs. This is beautiful bone, beautiful bone. This bone has a lip on it right there. That lip is degenerative disc disease, and it's progressive, or it can be reversed. Here's the same patient 1 year later, a little less apparent. Here's the same patient 2 years later, not existent. Understand, degenerative disc disease, degenerative joint disease, if caught in time, can absolutely be reversed. Every doctor out there knows that there's a law. It's called Wolff's Law. Bone is laid down where it's needed, resorb where it's not. It's a body's protective mechanism. If you realign and reshape that spine, you can reverse the degenerative process. Your body is built by God. Have confidence in it. I'm Dr. John Bergman. God bless.